Hi and welcome. This is Crystal from Safe Touch Rehabilitation, and today we will be addressing conditions such as asthma, heartburn, stomach cramps, really any kind of abdominal pain in this region. So I want you to consider these abdominal moves here to address severe symptoms such as asthma, and even that esophageal spasm when you have the acid that splashes up into your esophagus and then the esophagus goes into a spasm, which feels like you're having a heart attack. Any of those real severe symptoms, you're going to want to address just these anterior moves that I'm going to be showing you today. If you're working on somebody that has a lot of respiratory ailments and they're long-standing, then there are some advised prerequisites, and I will teach you those in a different video. They would be in the upper back video. All right, so to get us started, we see an HP here. So what does that mean? That's our holding point. And then coming down here, this little U is our xiphoid process. And if we walk down from our sternum, which is nice and solid, we get off into this little soft spot. Underneath that soft spot is a bone called the xiphoid process. Just below that, we have our solar plex. So if somebody hits you there, it's going to knock the wind right out of you. So this is actually an area that we're going to want to be addressing with our left middle finger. The reason being, notice that with my hand straight like this, my left middle finger is the longest one here. So that way, if I just relax my hands on the body, this point here is going to be the longest point. And this holding point is going to be addressing the vibration that we're creating with our future moves coming up here. All right, so now as I have my left middle finger on the holding point, I'm going to feel for the side of her body, and then measure halfway from that point to our holding point. And that's where you see my thumbprint right here. So as I've already taught you with previous videos, you've learned how to do the Bowen move. And in these videos, you're going to see a dotted line here, which shows you the direction or the movement of your skin initially, right? When you do a Bowen move, you actually take skin in the opposite direction as the actual move. So as we've discussed before, while doing your Bowen move, you need to create tension in two different fascial layers. The superficial fascial layer is very important, and it's also important that you don't slide over the skin like this. So I want you to imagine that you're putting your finger on the skin and super gluing it to the skin. That way when you move your hand, see the skin goes with you. Now this is called the slack. So you're going to create tension in that first superficial fascial layer by moving your thumb up towards your middle finger. See how that's getting at that top layer nice and tight? Then when she exhales, you're going to add pressure in towards the body like that. Look at that. All right, we're going to start from the beginning. So initially, you just take the skin as if your thumb has been super glued to the skin. You take it right on up to the holding point there, as far as you can go without sliding over the skin. And then as she exhales, you're going to add pressure. All right, so now I'm going to put everything together, because after we add pressure, we're going to do a move in the direction of this arrow. So take a nice deep breath in. Exhale. See how we take the skin up? We add pressure. Keep your breath out. I keep the pressure consistent as I move down and out. Now that creates a vibration that moves along the torso here, which is able to aid the function of the organs and address the nerves that are controlling those sites. Now on the right side, we're going to use our right middle finger. I'm going to place it just inferior, which means below the edge of the bottom of the rib cage here. And again, the dots, I should really have put an arrow right here because the dots just show you that you're going to take the skin up. I don't like to talk about the slack much because it's a lot like you're pulling back a bow when you're going to shoot an arrow. You know, you pull it back first to get that thing to move. So I want to tell you the direction to do your move, but I want you always to know that you first change and pull back that slack. So take a nice deep breath in here and notice how I'm going to move the skin up towards the holding point like that. Okay, we're going to do it one more time. I'm just super gluing my finger to her skin as I move it up. I'm not sliding. You don't want to slide. As far as I can go. And then I stop at that point. I'm going to do it one more time. What happens if once I stop? I'm going to add pressure. Exhale. There you go. Add pressure in towards the abdomen now. Keep that pressure consistent and move down. And that again sends the vibration around the abdomen. So those first two moves are going to address the lateral side here of the rectus abdominis and also the nerves that are integrated into those muscles. After that, we want to stimulate the vagus nerve, and we have an access point to that, which is right here. So what we're going to do is place our right middle finger just below that holding point. And as she takes a nice deep breath in, notice what we're going to do. Again, we pull back that bow. So if our move is going down, that means we first have to take the skin up and then shoot it down. So she exhales, we take the skin up. Look at that. And then we'll add pressure and move down. Show you again. So the move is down, but what do we always have to do first? Create tension in the opposite direction, just like we're shooting a bow and arrow. We're in archery right now. We're going to shoot that. So we're going to come first and create that tension, add pressure, keep the pressure consistent, and then move it down. And that's the third move out of the anterior thorax procedure.